So, Tarek, a question I often receive from Muslims preparing to get married is about birth control. So, for many reasons, they may want to delay or think about using birth control to prevent pregnancy. So, I'd love to hear the Sharia Islamic perspectives on this.
Sure, birth control is permissible. The companions practiced a form of birth control, and having children is not a necessary part of getting married. I know that's like a big news flash for a lot of Muslims. We assume that it's necessary. It's not. You know, the books of fiqh even talk about a woman who wants to preserve her physical beauty and doesn't want to have children because it will impact her physical beauty, is allowed not to have children. So having children is, I mean, it's usually a concern when you're getting married, of course, but it's not obligatory. That also teaches us something else, which in the issue of answering the Sharia ruling of birth control, we remember that at the end of the day, Allah causes what He wills to cause. So even with birth control, there can be quote unquote accidents and whatnot. And that's one of the wisdoms behind it, is that this is a human intervention. But at the end of the day, if Allah wants something to happen, it's going to happen. So we accept that, if you know, because we accept God's will. That's part of what being a Muslim is about. But certainly the idea of birth control, delaying having children, etc., that's completely permissible and should be done, I should say, in consultation both spouses.
That's such an important point for there to be a conversation or numerous ones about this so that nothing is kind of forced. Now, when we think about birth control, we often think of the woman. We often think of pills, patches, IUDs that are, internal to a woman's body, or we think about condoms like a barrier method. A question I often receive is vasectomies. Are those permissible? Because it seems like Islamic guidelines relate to reversible forms of birth control, not permanent ones. So, I'd love to hear your perspectives on this.
Yeah, so that's a little bit more troublesome because of the permanency of it, even if theoretically it can be reversed. But the idea of acceptable Sharia acceptable birth controls is that, as I said a moment ago, it's not 100%. I mean, maybe like 99.9%, but still something could happen. To reverse the way we have been created for no reason, and that's the key, no reason, would be not permissible. If there's a medical condition that requires it, that's different. That's what I meant by no reason. But if we're just talking about normal adults that I just want a permanent, I don't want to have children, I would advise against that, and I would use the other traditional methods of birth control.
Thank you for clarifying. I think that's important, and the emphasis on the medical reasons, because there are some women who do need hysterectomies. There are some men who do need vasectomies, or they'll have their prostate removed due to cancer or other reasons. So I think it's important that we realize the nuance in this discussion.
Yeah, Sharia is very liberal, of course, as we know, when it comes to medical conditions. And medical conditions is one of those situations where the impermissible can become permissible, and all these different nuances can take place because the preservation of human life is paramount. It's one of the meta principles of the Sharia. One of the maqasid is the protection and preservation of life. So when it comes to the medical situation, I think we'll find a lot of flexibility and leniency in all sorts of matters.
Perfect. Thank you for the clarification. It really helps, inshallah.
Alhamdulillah. Thank you.